Hey everybody, Luke here, and in this video I wanted to show you the top 5 exercises that I had posted previously for knee pain and patello-femoral joint pain. I wanted to actually go into more detail and just show you on a video how you can actually do the exercises, because I know sometimes it's a little bit hard to kind of visualize them if you haven't actually seen them. So just to give you a quick background, these exercises work well for all sorts of types of knee pain, but we're specifically talking about patello-femoral joint pain, which basically is an issue with the tracking of your kneecap. So in a previous video and a blog that I posted, and if you need that, just let me know, but I talked about kind of the different factors that influence knee pain and how this patello-femoral tracking issue can become a problem with things like the structure of your legs and your knees, hip issues, knee issues, the strength in your quad muscles and the strength in your hip muscles. So with these 5 exercises, what we're trying to do is we're trying to start strengthening the quad muscles, which are going to directly impact the tracking of the kneecap in its groove as you bend and straighten your knee, as well as the strengthening of the hip muscles, which the hip muscles, especially the rotators in the back and the abductors on the sides, those have a really direct influence on the alignment of your femur. So if you have poor strength back here, basically, your femur is going to tend to drift towards your midline, which is going to give you like a knock-kneed appearance, and that's going to pull the tracking of your kneecap out, which is what you don't want. And then with quad weakness, same thing happens. If you have weakness in your quad, especially on the inner portion of your quad, that's also going to tend to have your kneecap tracking towards the outside. So that's the background on these 5 exercises. So let's just go ahead and get into them here, and we'll go through them. So the first one is called the quad set. With the quad set, if you're out straight on a table, or you can just have your leg out straight on sitting on the edge of a chair, all you're going to do is you're just going to practice squeezing this quad muscle, which is on the front of your thigh. So just give it a good squeeze. As you squeeze it, you should kind of feel the muscle tighten up on the front of your thigh. And if you look at my knee here, you should notice your knee straightens out. So another good way to think of this one is just to push your knee down straight into the table. And again, you could just be sitting on the edge of your chair with your knee out straight and just squeezing. So the point of this one is that you're just going to start to activate this quad muscle. For a lot of folks with knee pain, you haven't necessarily lost all of your strength, but the pain is going to inhibit your body's ability to recruit the strength. So with the quad set, all you're doing is getting that muscle back online, basically reestablishing the connection from your brain and the muscle, so that when your brain says, hey, fire that muscle, you have good control of it. So with that one, you can basically do like a 5 or 10 second hold, do several reps at a time, say 4 or 5, and you can pretty much do it throughout the day. So again, I could be sitting here. I know you can't see my leg very well, but I can just be squeezing my muscle while I'm sitting, at my chair or my table, wherever you're sitting. So again, you don't have to worry about only doing a few reps here and there because you're going to overdo the muscle. You're not going to overdo the muscle with this one, so just go ahead and do it throughout the day. Okay, second one is a straight leg raise. That's what SLR stands for. Straight leg raise, basically, you lay on your back, opposite knee bent up, and then you're going to squeeze that quad muscle tight again, and then you're just going to lift it up in the air. About a foot or so. You don't have to lift it all the way to the ceiling because it's really too easy at that point. So just lift it up. Depending on your strength, that's going to dictate how many reps you do. But, if you want to be kind of generic, 2 sets of 10 is great once a day, which is kind of a generic way to look at all of these exercises when you're first starting. Just do them to your tolerance. So they shouldn't cause you pain, and you shouldn't be totally shaking with fatigue. But if you are after 6 or 8, then just go ahead and stop. So those are your straight leg raises. The third one then is a side straight leg raise. Remember the old Jane Fonda. So your bottom knee is going to be bent, your top knee is straight. A big key on this one is you want to make sure that when you're laying down, and I'm not laying down all the way here, but you'll want to, that your pelvis stays rolled forward. So when you roll your pelvis forward, you're going to lift your leg up straight to the side. So your pelvis is forward, your leg is in line with your body, it's not out in front. What will commonly happen, since if you have weakness in this muscle, is that your pelvis will roll backwards and you'll lift your leg out towards the front like this. You're like, wow, that's really good. I can do that one all day. You don't want to do that because you're targeting the wrong muscles. So again, keep your pelvis rolled forward. You should feel like you're hitting this muscle right on the side of your hip right there. Just lift it up and down. Again, 2 sets of 10 just as a general guideline. Next one then, clamshells. I won't go too far here. Again, lay all the way on your side. Pelvis forward. Now both of your knees are bent and they're stacked on top of each other. So keep your pelvis forward, feet touching, lift the top knee up like you're opening and closing a clamshell. My strangest video to date, doing a clamshell. But it's a good exercise, again, to strengthen these rotators on the back of your hip, which are going to have a positive influence on that alignment. Last one is a mini squat. So with a mini squat, Just a few key things here. When you're doing squats, you want to be about shoulder width apart, and you want your feet to be pointing forward. If you have weakness in your hips, a lot of times your feet are going to tend to rotate out, so your toes will turn out. The key to doing a mini squat at this stage, if you're dealing with knee pain, is you want to do it comfortably. So what will happen then, and I'll try to stay on camera here, is when you go down, you want to go down like you're sitting in a chair. The most common mistake we see with this is that people go down and their knees bend really far forward. So if your knees go in front of your toes, it's really going to hurt your knees if you have knee pain. And even if you don't have knee pain, it's just not good for your knees. So again, think of going like you're sitting in a chair, your feet stay flat. Think of keeping your weight back towards your heels and then pushing your butt back, and your shoulders will hinge forward. So you're hinging at the hips. Not the best view, I know, because the camera's kind of cutting me off top and bottom, but hopefully that gives you a good indicator of how to do a mini squat. If your knee pain is improving long term, you can certainly squat lower and lower. You just want to respect the fact that with all of these exercises, you shouldn't be making your knee pain worse. Obviously, the idea is you want to start feeling better with your knee pain, so that's a trick for a lot of folks when the knee is real irritated and painful. How can you do these things without causing a lot of pain? So you just have to kind of feel that out. It's going to be different for everybody depending on where you're at and kind of the recovery process. So, but if you can do these well tolerated, I would start with them like once a day. And over time, if you can bump it to twice a day, that's great. Keep in mind, you probably want to take days off in between there if the muscles have actually been worked pretty good. And you can always advance exercises from there by adding things like weights to the leg raises or adding like an elastic band to the clamshells. So hopefully those will give you some good starting points to, again, strengthen your knee, strengthen your hip, start getting on top of that patello-femoral pain, which is in front of your knee, right around your kneecap there. So hope that helps. If you have more comment or more questions, just leave a comment, or I'll have my contact information. You can always call me or email me. So that's it for today. Thanks for watching.